Hi there, and welcome to COVID-19 Now What, a weekly video series from the Easthampton Health Department. This is Amy Hart, public health nurse, and today is Friday, April 2nd, 2021. As you may remember, last week we did have a sharp increase in local COVID cases in Easthampton, and I recorded this video in my backyard to remind everyone to spend time outside when visiting with family and friends to reduce the risk of spreading COVID between households. This week, cases are still high, although there's a slight downturn, thankfully. And I'm going to share more with you about ways to socialize smart during this phase of the pandemic. At this point, most of us still have not been vaccinated yet, but we're seeing all around us that businesses, schools, event venues, and other activities are all opening up. Some states have even gotten rid of their mask mandates completely. Meanwhile, new cases are still much higher nationwide and locally than they were all throughout last spring, summer, and early fall. And there are also reported surges happening related to the more contagious version of SARS-CoV-2, the virus that causes COVID-19. So the question now is, how do we know what is safe or not safe to do for our families and ourselves right now? To help us make this decision, we can use the concept of socializing smart. To socialize smart means to not automatically accept every social opportunity that comes your way during this phase of the pandemic. Instead, we need to consider what the risk of getting or spreading COVID might be in a particular situation, and whether or not that activity or event is actually worth taking the risk. The first question to think about is whether you or anyone in your household has been feeling under the weather over the past couple of days, or is maybe waiting on a result from a COVID test. If the answer is yes to any of these, then you do need to stay home, no matter how well you might feel today, or how the other person as well, or how much you'd like to go to this activity. I encourage you to think about how you might feel if a positive result came back for you or your household member after you went to this event. And then contact tracers had to reach out to everyone who was near you that day. Most of us would really like to avoid this possibility if we can. Now, the other thing to consider is the current COVID risk level in our area. Are we in the green, yellow, or red zone currently? And have cases lately been going up, or have they been going down? You can check for this information on the City Health Department website, and we'll be looking at our own dashboard in just a few moments. Someone who socializes smart will stay home more often when local transmission is high. Also, I would encourage you to think about whether the event is going to take place indoors or outdoors. Outdoor activities are almost always safer than indoor ones. And also how many people are going to be at this event. The more people, the more chances of getting or spreading COVID. And do you know how many of the other people might already have immunity, whether from the vaccine or from having COVID the past 90 days? Do you yourself have immunity for one of these reasons? And are you particularly worried about the safety of anyone in your household if you were to bring the virus home? Now, let's say you've already thought about all these things and you've decided to go to the event or the activity. How long should you plan to stay? The shorter time that you're there, the less risk there is for getting or spreading COVID. So think about that. And then the other thing is, what sort of mask should you wear? Socializing smart means always wearing the right mask for the activity. So what that means is that if you are going to be outdoors and there's more ventilation, it's easier to keep 6 feet apart from people, a simple cloth mask should be just fine. However, if you'll be indoors with others for 15 minutes or more, double masking with a surgical mask worn first and then a cloth mask on top is a really good idea. You could also wear a tightly woven cloth mask that fits you well and has a pocket filter that you can place in between the layers of the mask, or perhaps a KN95 mask if you have one. If you're going to be indoors with others from another household, along with distancing and masking, you can also open the windows to improve ventilation and prevent the virus from building up in that airspace. It might mean wearing an extra layer to keep warm, but the inconvenience is worth it. Keeping that visit to less than an hour is a good idea too. And I'm sorry, parents, it's really still too soon for sleepovers and long indoor play dates right now. The local transmission rates are still just too high, unfortunately, which I know is really hard for kids. And if you do participate in a carpool, you want to think about your car as being a very small room into which several people are going to be seated for a length of time. And so in that space, everyone would need to wear their masks and have the windows cracked for ventilation. When I do carpool, I actually ask everyone to just not have conversation in the car, just to reduce the amount of potential virus that could be put out into the airspace. Why don't we take a moment now and look at the dashboard just to see how things are looking in Easthampton lately. Some slight good news to share. Let's see here, one moment. Here we go. Okay, so if we look at the top bar, we can see that, of course, we're still in the yellow zone for both the city and Hampshire County. Although, like I said, new cases are down a bit recently, and you can see this reflected in the center yellow boxes with our daily average and our test positivity rates both down for the 7-day period most recently. And in the 14 days, going back a little further, they had continued to go up. So we see that things had gone up and then they're starting to come down a little bit. Things are actually looking better in Hampshire County as well. If we look in the left purple box, we can see that our past week, and this is a more recent week than the one reported above in the 7-day average. This is what I have access to as a public health nurse to our local case data. So this ends on the 30th of March. Those 7 days, we actually saw a decrease by about 10%. You might remember from last week that things had been going up and we had to report a 123% increase a week ago. So this is good news. I also encourage you to look at the blue box that says current active cases on the left. So this shows people that are currently infectious. And now in the records, I have 40 people as currently being in this category. But the reality is it's probably closer to 100 or more, because a lot of people either get a false negative result or they never end up getting tested because they are asymptomatic, or everyone is sick at home and they just don't feel like they want to bother getting tested themselves, even though they also may have symptoms. So one thing I just want to encourage you, if you have symptoms and you test negative, please go get another test if you can't explain it away with allergies. And that's especially true if other people you know are sick and you've been exposed to them. And if anyone in the household is sick, everyone else should stay home. I just cannot emphasize that enough. And if they can isolate, if someone with symptoms can isolate within the household, that's also helpful. We are still seeing the virus spread really quickly within homes, although most people still seem to have no idea how they might have picked it up outside the house. With high local rates of transmission, that's just kind of how it goes. And as I make contact tracing calls, it does seem clear that people are getting out more and more socially, and that the number of close contacts that we're having to locate and put into quarantine is growing. So that's just another consideration to always think about, is who might be impacted by your choices, and including the people in your own household who might have to stay home from work or school. Now, if we go into the right blue box, we see that thankfully vaccination rates continue to go up. We are almost at 40% of local residents who are either fully or partially vaccinated. So this is great news. If you or anyone you know is currently eligible but having difficulty getting an appointment, especially if they are older and have trouble using the internet, please reach out to the health department so we can help. And this also is true if people are having language challenges, because I think the websites are all in English. So please reach out to us. We will do what we can to help you. Now, wrapping up, let's take a look at the center graph. I rotate these out every week, and about once a month, I'm looking at monthly trends. So this one will keep popping up as it evolves. As we can see, the numbers currently, if we look at the February, far right, March 21 numbers, the numbers are still much higher than they have been for most of the pandemic. As you can see, the far left, that's March 20th. So you watch the local cases kind of go up and down, but always staying below 50 per month. And then things really started to shoot up in November of last year. And then, of course, really up over the holidays, they got as high as they've been so far. If we look at where we are now, and then we go straight across to the left, we see that basically we are where things were in November, just hovering a little below 100 cases per month. This is not what we want to be seeing. And it's probably driven by a combination of relaxing our behaviors and the new, more contagious variant B117 out there. So I just want people to think about transmission being easy to occur anytime you spend time indoors with other people outside your household who may not know that they are carrying the virus, and you yourself might be carrying it too. So I'm going to stop sharing the video now. And I just want to wrap up by thanking you for tuning in. Please do reach out to the health department if you have any questions, concerns, or topics that you'd like me to include on future videos. Stay well. Thank you.